My own opinion is that anybody diagnosed with AML should really be getting a second opinion at a major center. It is a very specialized disease, and there are some complications that can ensue from treating the underlying disease. Often what happens is that patients are told, well, it's acute leukemia, and maybe the white blood cell count is high, and so we don't really have time to refer you anyplace. We need to get started now. That's not exactly true. Yes, it's acute leukemia, and you don't want to be waiting weeks, but what we and others have found over the years is that if a patient has a high white blood cell count, and you do want to get it down, there's an oral chemotherapy agent called hydroxyurea, which really has no side effects and won't get rid of the AML. It's not going to get the person into remission, but it can bring the white count down fairly quickly and allow a bit of a window to get that expert opinion, which I think, again, is very important. So I don't think people should just accept it's acute, we got to start today. And that's important because once you embark on a path of treatment, you're kind of stuck on that, right? I mean, you can't give chemotherapy and a week later decide, well, I don't think I want that treatment, I want something else. It's a little bit too late then. So I think it's very important, and it's also important to know that most major centers, if they get called about acute leukemia patient, will see the patient within a day because they understand that there's some urgency here. So generally, I think that's extremely important. The therapies are not necessarily different at investigational centers, the standard therapy, but of course they have clinical trials also. And then the person can hear about the trial that may be beneficial to them. Don't forget, any great drug that's approved by the FDA was utilized first in a clinical trial. And so people that were on those clinical trials potentially have access to what could be, not always, but could be a really great drug, well, months to years even before it becomes available. And those are kind of clinical trials are going to be at major centers. Even if the patient, say, doesn't qualify for a trial and they're going to get what's more or less the standard therapy, they may decide to have it at home, but they may also want to know that the chemotherapy for AML has some side effects. You do lose your hair. It can cause some nausea. It can cause some diarrhea. But the biggest risk when you're getting AML chemotherapy are not those acute side effects, which occur over several days while the patient's getting the drugs. It's the fact that right now, in order to clear out that bone marrow, to clear out the leukemia, we have to give chemotherapy that knocks out the whole bone marrow. So what does that mean? That means to get rid of leukemic cells, we have to get rid of all the cells that are in the bone marrow. Now, oftentimes people with newly diagnosed acute leukemia don't have normal blood counts. Obviously, they can have high white counts from the leukemic cells, but they often have anemia with low red blood cells or low platelets because of the leukemia kind of crowding out the marrow. But even people with normal blood counts, relatively normal, all of the counts are going to drop and go down very low. That's a necessary side effect of being able to empty out the marrow. And the issue when that happens is that there are several risks, right? When you don't have normal white blood cells, you're at risk for infection. When you're anemic, that's the easy one to treat. You can get a red blood cell transfusion. If your platelets are low, you're at risk for bleeding. Now, we can give platelet transfusions, but we can never get the platelets all the way to normal. So the point I'm making is that it's not the side effects per se of the chemotherapy that create the risk or the difficult time when you have to be really careful. It's that all the counts are going to go down. So the point I'm making is that even if somebody's getting standard therapy, if they're being treated at a center by physicians who really have not had much experience with acute leukemia patients, that can be the risk, not the chemo itself.